Findings from the CREs will result in an efficient and effective health policy that leads to Australian health service delivery being among the most proficient in the world. But what we need to do is build that innovation into these centres of research excellence. So how do we do that? We do that through an interaction of the sub-themes and the major overarching themes. Can we do a sort of backwards and forwards flip in these? So can you go one more forward on this? So here, you'll see this in your information for applicants. This chart shows you it shows you 4 the overarching themes. What we've done for simplicity and to streamline matters is to roll themes 2 and 3 together into theme B. So actually theme 2 I think is prevention, and theme 3 of the National Health Directives is management of chronic conditions. So we've pulled those together into B. So across the top of our chart we've got the 3 national key themes, and then on this chart we've got 14 sub-themes that you can address, and Bob's just flicked to the extra 4. Thank you. So there's actually a cross-match of 4, a cross-hatch of 18 themes that you can address. We understand there will be overlaps, that it'll be very hard to stick within one theme A and anything that's underneath that. So can you just go back one to the big chart, please? Thank you, Bob. So what we're looking at is the 3 national themes, and you must address at least one of those. And you've got those 18 sub-themes. So common to all of those sub-themes could be the last 4. So these ones can appear under any of the 14 in the chart. A research design illustration may be that you propose a study that seeks to identify the optimal workforce mix and training, which is sub-theme 16 up here, required to facilitate the provision of primary health care services to adolescents, which is sub-theme 4 on the left-hand side here. Can you see how there's an overlap already happening? That promotes self-managed care of chronic disease, so we're addressing priority area B. Secondary outcomes might include reduced hospital admissions, sub-theme 11 on the bottom of the central column, and improved regional and service integration, sub-theme 5 in the left-hand column. So in actual fact, this innovative research project is covering the national key priority areas of A and B, with a number of sub-themes that are actually putting the flavour and the interest into the research proposal. So I guess with that matrix of themes and sub-themes, that allows you the depth and scope of creating a very innovative research work for your Centre of Research Excellence. So please do have a look at the handouts, because it's really clearly explained in that. But remember that you can't just pick one of the sub-themes, you have to relate it to the national key priority area that's going to influence policy, systems and service provision in Australian healthcare delivery. Thanks, Bob. Terrific. Now, the Expert Review Committee needs to see details. They need to ask the who, what, when, where and how of every aspect of your research proposal. So while it might be easy to address those regarding your research methodology, remember that that's only one component of your proposal. You also need to address those with your knowledge translation and exchange model. Who is going to be responsible for that? How is that going to occur? At what stages of my 4-year program will knowledge translation and exchange occur? The governance model, who's going to be involved? Why? How? Your PhD students and your postdoc fellows, how will they be involved? Who's going to supervise them? Where will they be located? And when it comes to an international visiting expert, it's probably not a good idea to just say, look, we'll get one, trust us, just give us $8,000 to bring them out. We actually want to know who this person is going to be and how they're going to relate to the research outcomes and aims of your Centre of Research Excellence. So this is why we're giving you 3 months plus a couple of days in our generosity, to actually work everything together so that you are providing a very well, thoroughly prepared proposal, so that the expert review committee aren't left standing going, well, we don't understand this, where's the extra information? You basically, this is your one chance. You don't get a second chance at giving the information and answering their questions. Thanks, Bob. Now, looking at the budget, again, that can often cause a few questions. Outside the front is a modern version of the Centres of Research Excellence Handbook. Please take at least one or some of those if you can, and all the budget items are included in that, as well as in your information to applicants pack. So it's pretty clearly explained, so do have a look at that. We will cover your direct research costs, but again, the expert review committee will say, well, how come they're asking for this? It doesn't relate to their methodology or to their research design. So everything's got to dovetail one into the other. Ambit claims don't sit well. We will cover the costs of consumer involvement, of your knowledge translation and exchange activities. The justification is one area where the chief investigator, A, can actually explain why you're asking for this particular pocket of funding. It might be something slightly unusual, such as access to a data bank, but if the CIA can actually justify that cost as being integral to the methodology and the research design, they've got a good case of getting that funding. Make sure you've used the most cost-effective means for a particular request. A lot of our collaborative work will be involving centres across Australia, and it's often not cost-effective to expect a team of CIs to travel from Perth to Darwin to Brisbane or Melbourne for meetings. Maybe the most cost-effective way would be Skype or video teleconference or ordinary teleconference. The Expert Review Committee are accountable for the most effective expenditure of government funds, making budgetary justification among their particular interests. Thanks, Bob. This slide is just for your information, so that if you are one of the lucky ones to get a CRE, these will be your reporting requirements, and they are according to your contractual obligations. So annually, you will be required to report against work completed to date. That will include publications, your collaborations and what you've done collaboratively, your KTE endeavours, student progress, an annual financial acquittal, and a detailed research plan for the forthcoming year. In your annual meeting with APHCRI, where you will come to Canberra, you will also be required to prepare a verbal progress report of progress to date. And as we've said, the final progress report will be in the 1/3/25 format. Again, that's explained in one of these booklets outside called Author Guidelines, so do pick up a few of those. If you have any trouble with the templates, please call APHCRI, because we can help you use and get your head around those templates. Some of them are a little bit tricky to work with. So I think Bob's going to talk to us a little bit about the contracts and how to deal with a contract.
Thanks, Dagmar. The simple word is expeditiously. We've taken the approach, we've had various issues around contracts, and as those of you from universities will know, when you get a grant, the hardest part of getting the grant is actually sorting out the contract with the funder. We've tried to streamline that process further for this round of CREs. We have a contract. The money we use to fund these projects, as we've said several times, comes from the Department of Health and Ageing, and that comes by way of a contract or a funding agreement between the Department of Health and Ageing and the ANU. And the ANU, as part of that contract, has to meet certain obligations. I'll call it a contract. It's technically a funding agreement, but it's effectively a contract. There are two parts to that contract. One is a general part, which is a standard Commonwealth Government requirement for all funded or funds they hand out. And then there's the schedule to the contract, which is the specifics that have to be met. we pass that responsibility or that risk on to the institutions that accept the grant from us. And again, we pass on the contractual obligation in the first part, if you like, the core contract, in terms that our lawyers have advised us is this university's way of meeting its obligations in terms of delivering back to Doha on that contract. So we've taken the view now that that part of the contract will not be negotiable. We've put that contract on the website, that part of the contract, and we've got the reference there. I just emphasise that will not be negotiable. If you were to be offered, if you were to apply and offered a funding, and then your university or institution were to say, well, sorry, we don't like clause whatever, well, I'm sorry, we're just not going to negotiate on that. We have a clear policy view from this university that that is required for us to meet our obligations, and we will do that. The second part of the contract, of course, is negotiable. That's the schedule to the contract, and each of these CREs will have a different schedule because each of them is doing different things. Now, there's some timelines in there which sort of aren't negotiable, but I suppose there is prospect as part of any grant for that to be changed, and there are some funding suggestions how we would, the way we, a small amount of funds in the first year, maximum amount in the middle 2 years, and then tapering off in the third year, because we can't guarantee the funding will continue beyond year 4.